Hi, this is Dr. David Zahaluk, and I've got an update for you on vitamin D metabolism. Did you know that up to 20% of Americans are deficient in vitamin D? This is a relatively new fact for me, and we've started to test our patients at the time of their physicals for vitamin D levels, and I've been really surprised at how many folks are really deficient in this vitamin. Now, what does vitamin D do? Well, vitamin D really regulates calcium in your body. At your intestinal level, at your gut, it helps to absorb calcium and phosphorus into the bloodstream. At the kidney, it helps to prevent the loss of calcium and phosphorus into the urine. And at the bone, it helps to promote proper remodeling of the bone. Now, how much vitamin D do you need? According to the National Institute of Medicine, we all need as adults about 200 units per day. The measure is IU, or international units. However, if you're a teenager or a woman who's pregnant or breastfeeding, probably 400 units a day would be better for you. And also, breastfed babies don't get very much vitamin D from the breast milk, so usually they need supplementation as well, usually with drops. Now, what are the sources of vitamin D? There's two: sunlight and your diet. When you're in the sun, the sunlight, the UV rays convert cholesterol under your skin into vitamin D. And in your diet, fish, fortified milk, and eggs, specifically the yolk of the egg, provide you vitamin D. And then a lot of people take supplements, either a multivitamin or Oscal or Tums or something like that. So that's how you get it. Can you get too much vitamin D? It's really uncommon to get that. The National Institute of Medicine says 2,000 units per day is the maximum you want to take in a normal state, unless you're deficient. And, hypothetically, you could run into toxicity from that, where you would absorb too much calcium and perhaps get kidney stones or excessive calcification of your bones. But we really don't see that too often. We normally see too little vitamin D as a problem. Now, how do you get your vitamin D level checked? That's very easy. You just do a simple blood test. The test is best done early in the morning between 8 and 10 a.m. And it's very easy. We do it, like I said, often at the time of our patients' physicals, but it can be done anytime. And you get the results back. The levels that are considered normal are between 32 and 100. And if you're below 32, you're deficient in vitamin D. And if you're below 28, you're considered to be very deficient. And the amount of vitamin D we prescribe depends on your level. So if your level is very low, if it's below 28, typically doctors will prescribe 50,000 units taken as once per week in a pill for about 6 or 8 weeks, and then they'll recheck. And if the levels come up, they'll put you on a lower level of replacement. On the other hand, if your levels are between, let's say, 28 and 32, typically the doctor will prescribe 800 or 1,000 units per day, and just to kind of keep things from getting too low. Now, why is it important that you have good vitamin D levels? Well, 3 main areas that we're concerned about. Number 1, the skeleton. Number 2, the energy level. And then number 3, the effects on heart and on cancer. Most commonly, we see as an effect of low vitamin D levels osteoporosis in adults and rickets in children. You don't see rickets very much because of the fortification of milk and the proper screening that we do. But a child who has not enough vitamin D will probably fail to reach their expected heights, and sometimes their bones are soft and kind of rubbery, and those are children that you'll see with kind of really bow legs. We don't see it very often nowadays, thank goodness. But more commonly in adults, you might see brittle bones or osteoporosis, where there isn't very much calcium mineral in the bone, and those folks are prone to fractures, even fractures without any severe trauma. And of course, worrisome are the fractures in the hip and the pelvis, because those are the ones that will disable someone. Also, though, low vitamin D levels, particularly when they're very low, can affect your energy levels. And I sometimes will see people notice a significant change in their energy if they had low vitamin D and we replace it. But often that's subtle. It's often not very overt, but noticeable if you ask a patient. And then the more recent findings, which are also more worrisome, is there seems to be a correlation between heart disease and low vitamin D levels, and cancer of the colon and low vitamin D levels. So all good reasons to get your vitamin D levels checked with your doctor and make sure that you're on target with your vitamin D to have good health. Hope that's helpful, and we'll talk to you later.